So we are here tonight to watch the MS Advocacy Hub. It's a virtual program, as you can see. And next we have About Me, all right? But everybody knows about me already. And I'm the president and founder of MS Views and News. And anything else about me, you'll have to learn another time. Tonight's program is sponsored by Sanofi Genzyme, Bristol-Myers Squibb, and Biogen. And tonight we have guests. We have June Halper, who's basically the CEO and head of the Consortium of Multiple Sclerosis Centers for a very long time. We'll hear from June in a few minutes. And we also have Nancy Chazen. She's the administrative associate with the Cmsc. And we'll also hear from Nancy in a few moments. All right, so let's get started, everybody. Right, here we go. Nancy, June, thank you for joining me tonight. And
you're so welcome.
Thank you.
It's a very special day.
It is a special day for everybody, right? Less mask wearing. So I'm going to ask you each to, and I'll start with June. Can you please introduce yourself? Give us a little bit of background about your history and how you got into this space of doing what you do for the MS community.
Well, when I first started out in nursing, I was doing a lot of public health, and a number of my patients had multiple sclerosis, and somehow I landed a job which was part-time, which evolved into full-time with the National MS Society, and the rest is history. We opened an MS center here in northern New Jersey, which I ran for 25 years, and at the same time there was a group of physicians who founded the Consortium of MS centers. And eventually I evolved into a CEO position. So I'm still a nurse practitioner. I still love the work that I do. And basically I fell in love with the disease to try to help people because it's not a nice disease, but I do love the patients. So.
Yes, thank you. And thank you for that. And Nancy, what about you? Nancy's a little frozen there. Okay.
Oh, sure. Can you see me now? I'm frozen still?
Yes.
Hello?
No, you're good. You're good.
Okay, great. Okay, so I started very differently than June. I always worked in social services, and I worked for a number of agencies focused on early childhood development and family development. And there came a time in 2000 something, I was looking for a new job, and I saw an ad way back when for the MS Society in New Jersey. I applied for it because they were looking for someone with a social services background. I applied for it, and I was there for 11 years. And a few years ago I left there, and June and I met up, and here I am today working with June and the team over there.
Great, thank you. So before I ask you your next question, I just want to let the people that are online know that if you have any questions relative to what we're talking about tonight, anything that either June or Nancy talk about, if you have any questions about it, please use the question box, type in your question, and I will call it out to them either during the main portion of the program or following all of our questions. Okay, take it away. All right, what's next? All right, so either one of you, if you can tell me, well, June, this is probably definitely a question for you. Probably definitely, all right? Can you tell us what the Consortium of Multiple Sclerosis Centers is and what the purpose of the organization is about?
It's an organization of MS centers, individual practices, hospital-based specialty units, and a lot of individual providers who either specialize in MS or focus a good deal of their practice on MS. And the difference between us and the American Academy of Neurology is that our organization includes neurologists, nursing professionals, PAs, which used to be called physician assistants, mental health specialists, and a full cadre of rehab specialists. People like Nancy, who was involved in social services, play a very big role in our organization. And we espouse the team approach of managing MS throughout the lifetime of the disease. So our membership represents that cadre of people designed to fight MS together, along with the patient and family.
Okay, thank you for that. How long ago was the Cmsc founded?
1986.
And how many members are in your organization?
Right now, we have about 230 MS centers. We also include a lot of VA programs throughout the United States. And our membership goes as far down as Puerto Rico, which is a protectorate of ours. It belongs to the United States, as well as Canada and Alaska. So, well, Alaska, of course, is part of the U.S., but we're spread out all over North America and the Caribbean.
How does somebody find one of the centers that you're involved with?
That's easy. Website, www.mscare.org, and you can see the centers listed up there. And in addition to that, we also have certification exams for nurses as well as clinical specialists. And on the website, there's also a listing of specialists that have sat for the exam and are spread out all over North America with the credentials of MSCS, MSHA, or CRND, people that specialize in either MS or rare neurologic disorders.
Got it. Thank you. And how does a person with MS learn of any resources that you might have that might benefit them?
Well, the website, and then I think the biggest thing that we have done over the past decade and a half was the MS Coalition, which Nancy's involved in. I think the sharing of information and speaking with one voice. Nancy, you want to talk about the coalition? Uh-oh.
Sure. We're a member of the coalition, as you Stuart.
Yes.
Yeah. Can you hear me?
Yes.
Okay. Yeah. So the CMC is a member of the coalition.
Right. Her voice and her visual are a little bit off. So let's just let her speak. And even though you might see her lips moving and no sound coming out, it does follow up. And then when her sound is still coming out, her mouth has stopped moving. So let's just let Nancy go with it.
Yeah, go, Nancy.
All right. Well, let's see how this works. Okay. So the CMSC is a member of the MS Coalition, as is your organization, Stuart. And we, as June said, we are one voice for the MS community. We share resources, we share information with our constituents. And as far as programs go for patients, the consortium has one program a year, and it's at our annual meeting, which is coming up in October. Did you want me to speak a little bit about that?
After. I'm going to get to the annual meeting later on. Okay?
Okay.
If we could hold off on that, that would be great. Can you tell us primarily who is the audience for CMSC?
Well, not the audience, they're members. For instance, if you have an MS center in Cleveland, when they join, there's one membership fee, but everybody at that center becomes a member, including secretaries, medical assistants. Everyone in that center belongs to the CMSC once the center joins as a member. In the sense of a single practitioner, obviously, it's just one person. So if you have a psychologist or a social worker that joins as an individual, but the membership is all professionals, or licensed professionals, people that either specialize in MS or have a special interest in MS, or just want to learn about MS, because many people have joined us because they take our model and use it for other illnesses such as lupus, rheumatoid arthritis, and other illnesses that are chronic, that require rather strenuous medication to modify the disease course. So many times we're joined by people with other illnesses in their background as their specialty, but they learn from us, and we've done a lot of collaboration with those organizations.
So what's the benefit for a person to be a member to join your organization?
Well, it's obvious if it's a physician or a nurse, it's the most important thing is knowledge and networking. You know, and of course, the other thing that CMSC does, in 1995, we started a registry called NARCOMS. I don't know if any of your listeners belong to NARCOMS, but it's the oldest and the largest registry. We have over 30,000 people that have been in that registry for many, many years. And we've learned a lot from the registry, which benefits patients. And many of them online probably know that we've learned from NARCOMS that smoking is terrible for MS. We used to think it had nothing to do with it. It does. It definitely causes inflammation, and it can cause MS to get worse. Vitamin D, obesity, hypertension, All those things have been known now through NARCOMs to contribute to MS disease progression. But we now know also there are things that are beneficial: activity and exercise, keeping active. When I first started in MS, probably before your time, Stuart, Dr. Leib Scheinberg said to patients, don't stand if you can sit, and don't sit if you can lie down. That was the philosophy. And today, that's the worst advice you can give someone. We've also learned about pregnancy from the registry. So the registry has been a great contributor to knowledge, and that's one of the things that the consortium has given to society. And of course, the other thing is the team approach. The neurologist alone doesn't have to manage MS. He's got a team behind him, because it's a very tiring disease, not only for the patient and family, but it can be very exhausting for the professional. And having a team behind somebody, I think, really makes a lot of sense.
Right. Thank you for that. Now, NARCOMs. First off, I want to let you know that I've been doing the NARCOM survey since I was diagnosed, I think. And I was diagnosed in 98. I don't remember when you actually started this, but I know that it comes out like twice a year, and it's a very long survey. Very long survey. It's very in-depth. I mean, anything that you can contribute about your MS, it's very well worth to get in it. So question about that, though. If a person decides to join or start getting the NARCOM survey now, is there something wrong with them jumping in now?
No,
many years after being diagnosed?
No, we want people to jump in. I don't care how long they're diagnosed. The more people that join NARCOMs, the better it is, the more we'll understand MS. Also, there's a wonderful magazine that NARCOMs puts out called NARCOMs Now, which comes every couple of months. It's 4 times a year. And let me tell you, it's as good as any scientific publication you ever read. And it's a very, very valuable tool. And it's a way of our thanking the patients for remaining consistent in their reporting. I know it's a long survey, Stuart. It's a long survey. There's no question about it.
Exactly. Some of the information that's in your magazine we use and that we post up and we put out to our communities as well. What is the difference between NARCOMs, NARCOMS, and NARCOMs, NARCRMS?
Yeah, NARCRMS was started the CMSC started it in 2014, and the difference is NARCOMS is patient-driven. The doctor or the nurse or whoever you see clinically don't have to give any information out. It's all patient, what we call self-report. NARCRMS is clinically based, although we have a patient advisory board for that registry, and there are patient-reported outcomes that are included. But it includes the neurologic exam, MRI, blood work. In other words, it's clinically based, and it requires an IRB, an investigational review board, which monitors research. NARCOMs has an IRB, but it's really dedicated to patients' well-being. There's no physician involved.
Okay, thank you for that. Where do you guys get your information from regarding the research that you're publishing?
Oh, well, that's our journal, our journal, the International Journal of MS Care. And by the way, one of my dreams someday is, if I ever got the funding, is to put out an edition for patients, because some of it's quite technical. We started the journal in 1999, believe it or not, and we were strictly online, and we were way ahead of our time, and nobody used it. So we gave that one up pretty quickly. And we started doing paper, hard copy. And today, of course, it's published both online as well as hard copy. And we get submissions from all over the world. This last, I think it was 3 months ago, we had total submissions from Europe. It was a special issue dedicated to a group in Europe called RIMS, Rehabilitation in MS. And all the articles in that journal came over from Europe. It was quite interesting to see the comparing and contrasting their patterns of rehab as opposed to ours here in the United States.
Okay, thank you for that. Before I get to the next question, there have been a lot of people that joined us since I first made the announcement earlier. If you have any questions regarding or relative to the topics that are being discussed here, the answers that are being given, if you have a question that can, tag along to what has been said or just something else, please use the question box on this page. by clicking on the orange button at the top, and then you'll be able to type in your question. I will ask your question to either June or Nancy. If you don't put a name there, I'll just ask either one of them. All right, great. Next. All right, let me ask Nancy a question, since I don't want her to just sit there looking at and wondering, and when am I going to ask her a question? So can you tell?
Keep going with it.
Well, I'm gonna bounce around. All right. I just don't want you to. I want to hear you again. All right. Can you tell us, please, about the foundation? What about the foundation of CMSC?
Sure. The foundation is the arm of the CMSC that it supports the mission of the CMSC, and we focus on activities related to building the MS workforce of the future. And we have a few initiatives that do that. We have a medical student research program. We have our mini mental health mentorship program. We have a rehabilitation training program, and those are really very important. Again, you hear that it covers all areas. It's not just necessarily the medical doctors. We've got rehabilitation specialists, so it could be OT, PT, speech, and then we have the mental health program, which is for social workers, psychologists, nurses. So we took a hit during the pandemic. We weren't able to do as much as we wanted in 2020, like everywhere else. So those programs happen to be put on hold, and we're looking forward to getting back to them in the fall.
So those programs, who are they exactly for, though? Is it to benefit the patients?
Of course, anything we do.
Well, it's for education for the professional. It benefits the patients, right? But it's so for instance, the mini mental health program, social workers, nurses, psychologists, they would be paired up with MS Center professionals in the discipline, and they would be paired up with them and train with them for a week, and then bring that information back to their own centers and their own practices.
So how can more
it enhances their knowledge about working with people with MS.
Sure. How can more MS patients learn about those services available at these centers?
Well, they would contact their own.
Yeah, well, some centers don't have the full staffing. Nancy?
Yeah, some centers don't have it. I mean, obviously, they would have to go to their own center and ask. And if they are not connected with Comprehensive Care Center and they want to be, I mean, certainly they can contact the consortium. They can send a message through our website. I answer those all the time from people. If they're looking for one close to their community, we can certainly give them the information from our database. June, did you have something to add to that?
Yeah, just remember, MS centers don't have to be within walls. We call that centers without walls. In fact, when Nancy used to work with the society, I would we would collaborate a lot. And there were some patients that went to an individual neurologist, and yet the patient was having trouble. So Nancy would find them resources within the community to build them a center without walls. You know, they liked their neurologist, but they needed a social worker or they needed a nurse. So Nancy, in her role, helped them build their own center. They had to travel perhaps a little bit. You know, it wasn't all in one spot. But that concept is very important to us.
Right. Is there any way that we can get a hold of a list of what you have? And so that way we could at least, you know, let the patient base see where specifically they can have these services available?
Online, all our comprehensive care centers are listed. And if you click on it, it does list the personnel.
Okay, great. Okay, great for that. All right, let me back up for a second to back to the NARCOMs, because Tammy has a question for you. And where do we find the NARCOM survey? And this is a good question because I forgot to ask it.
www.narcoms.org. You log on and it will guide you to a registration area. And it's all confidential. It's all password protected. And then you turn your head and they'll ask you if you want to do it paper and pencil, although they would prefer you're doing it online. It's certainly much easier to record. But it's www.narcoms.org.
And then you also get to stop if you need to, because it is really, really long, but you can pause and nothing gets lost, everybody. It does save, all right? So that way you don't have to even come back to it the same day. You could get back to it the next day or the day after, whenever. All right. And it'll just pick up again from where you left off.
Right.
All right. So that's what's really great about it, because wow, the first time I went to go do this, I said, wow, when does it end? It's like, wow, it's crazy. It's very good though. Very, very good. All right. Let me ask you another question about the foundation. How is the foundation funded?
Oh, good question. Mostly through grants. People can make donations, but we have a grant writer on the team, and she's great, and she's always looking for the next grant to support our programs. And we have Amazon Smile, so people who shop on Amazon, there's that Smile option, and you can choose us as the organization of your choice.
Okay, got that. All right, great. And is there any, well, you already said that about is there any other way that they can provide funding directly to you? Is it available through the CMSC website?
Yeah, it's right on the foundation website, on the CMSC website. There's a button you can hit, donate, and we'll be glad to take your donation.
Absolutely.
Okay. Great. All right, tell me about, I don't know who wants to answer this, but tell me about MS Teamworks, please.
Oh, MS Teamworks. That's we love that, baby. Yeah, I'll go back a little bit. There's something online called TED Talks, and I sort of fell in love with it. I just felt it's so interesting because the topics vary, and it's a nice dialogue. And I said, well, why can't we have this with MS? So I came up with the name. If you remember, Steven Spielberg's has DreamWorks. So ours is MS Teamworks, and basically they're brief online dialogue of people with MS, patients, families. We've even had one young woman with a baby actually had a dialogue with Pat Coyle talking about pregnancy. Pat was a little uncomfortable with the baby. So they're short, they're online. We've had over 75,000 views, and it's growing. And each year we add different topics, and MS Teamworks has been a favorite of both professionals, patients, families, and we're very proud of it.
That's great. Nancy, you look like you had something to add to that, but can you tell us, please, how to access MS Teamworks? Sorry.
Oh, you can go right to mscare.org, and you can get it through our website. Can you hear me?
Okay. Yes.
Okay.
Yes. And you look like you did want to say something about it twice. So do you want to add something to that?
No, June covers it beautifully.
Okay, great. All right. So next, COVID-MS, huge subject. All right. Huge. And right now there's so much probably for you to tell us about that, but can you tell us how CMSC is involved with the COVID-MS research?
Yes. Well, with NARCRIMS, we have a team that meets once a week. And if you remember last March 13th was the last day we were in our office. And I was becoming horrified because I was starting to hear stories about patients getting MS. So I met with our team for NARCRIMS, and I said, we've got to start a registry immediately. And we heard the MS Society was doing the same thing. So we called and got a hold of Bruce Bebo and the team down at the Society. And as the Society will do, they said, well, it's going to take a few weeks. I said, no, we're going to start it tomorrow. So we started, and believe it or not, on April 1st. And right now we have over 3,000 patients. It's open to the public. It's COV, small I, MS. And on there, you can actually get all the data. It's open to anybody that wants to take a look at it. All the data are there. We were very frightened about possible deaths related to COVID, and we're reassured that it's not any worse than the general population. In fact, we're going to be doing some analysis next Tuesday. We're going to spend some time on it. I think because people with MS are under the care of professionals, we may see less tragic circumstances than someone who is not under the care of a clinician. So, but it's an evolving story. But COVID-MS has been a wonderful collaboration with us in the MS Society, and hundreds of reporters, hundreds, and it's all anonymous.
So MS Visa News has had COVID-MS on our website homepage since
Mhm.
you began. And,
Right.
for anybody that wants access to it, you don't even have to ask for a website address. Go to the MS Fusion News website,
Right.
and it's right there on the top right of the page. Just click on it, and you'll get all the information that June was just speaking about. So again, though, somebody's asking to tell you again how they access the CMSC website.
Nancy, you tell this time.
It's simply www.mscare.org.
Very good. mscare.org. Got that? All right. I'm not going to announce anybody by name, but there's a couple of people that have been asking. All right. Next, can you explain? Let's talk about the annual meetings, because this is a big topic, and there's probably a lot to speak about. For anybody that does not know, the Consortium of Multiple Sclerosis Centers has an annual meeting every year. It's become like a giant conference for all the pharmaceutical to be there. All the patient advocacy organizations, large, small, and indifferent, are there. Everything that has basically anything to do about MS is there, okay, and exhibiting. And this year they're doing it in Orlando, Florida, and it would be awesome for whoever could get down here, to Orlando, which is like near where I am right now. I'm sure that June would love to see a large audience there of patients coming in and reviewing things, as well as all the professionals that will be there as well. So can you explain to us, please, tell us the importance of the annual meetings?
Well, the annual meeting is like, how could I say, a refresher. This past year, we had to cancel our live annual meeting, and we actually quickly put together an online. But I can't tell you how many times that Nancy and I have heard from people, we miss you. We sort of replenish each other. We refresh each other. We learn from each other. We have times together. Patients are very welcome to attend a meeting that we set up for them called More About MS. It's actually coordinated by Dr. Randall Shapiro, one of my heroes, who was one of the founders of the Consortium of MS Centers. That meeting has its own exhibit hall, its own luncheon and breakfast. And so anybody with MS is welcome. It's free. It's going to be taped. It was taped last year, and we had over 500 views after the meeting. That, people that kept logging on to watch it. And the big meeting, which is for professionals, and it's accredited for physicians, for nurses, for rehab specialists, focuses on all aspects of MS, comprehensive care, and with, as you mentioned, an exhibit hall. But the exhibit hall is not the big part of it. It's the meetings. It's the time that we get together in our roundtables.
Well, that's my next question.
Yeah,
I haven't gotten to that question yet.
I didn't make it up. Okay, go ahead.
No, you didn't make it up. I haven't gotten to the question yet. I'm going to ask you, what's the importance of the annual meetings, as far as what are your principal topics for the healthcare industry?
Well, it's the latest and greatest in terms of research. It's learning about the pathophysiology of MS. We have doctors coming over from Europe, so we've learned a lot about the cellular level. Neuroimaging in MS, the value of MRI, other types of tests such as serum neurofilament light chains, the OCT, which is a test for visual acuity, rehab techniques. Symptomatic management has always been a very, very important part of our meeting. Things like bowel and bladder pain, spasticity, where the nurses come in, and of course, mental health issues that are extremely important, particularly as you mentioned earlier this year. Also, we have platform presentations of current and ongoing research, and a poster session where people make posters and display some of their work that may be ongoing or complete, and late breaking news about clinical trials that are just finishing or research that's just being completed. So it's chock full of a lot to do. And I do advise people when they come from the various centers to wear flat shoes, because we got them walking.
That's true. So quick question about your meetings that you're doing that you just explained. Are any of them virtual where the patient community can watch this as well?
I can't stop them from going on. It is a hybrid meeting. And again, if the patient wants to spend the money, we are not giving it away for free like we did this past year. There will be a charge and you've got a password, but patients are more than welcome to log on. There is a cost involved though, because we got to recoup some of the expenses that we are going to undertake with the virtual as well as the live meeting.
Okay, but as far as attending, will it cost the patients to come in to browse the exhibit hall?
They're not allowed in the exhibit hall.
Oh, they're not allowed in there. Sorry about that. I didn't realize that.
Yeah, the pharmaceutical guidelines will not allow a patient to come in, and that's not because of us or pharma. That's the rules of an organization called pharma. And if you have people with MS or any disease going into exhibit hall, they have totally different exhibits. So the exhibits that will be more about MS will be geared for people with MS.
Gotcha. So tell us about the patient portion of that, where your patient meeting that you're doing with Dr. Shapiro as well.
Nancy?
Sure. Yeah, that meeting is free, and that exhibit hall is free. So anyone certainly in the Orlando area is more likely to go to it. That also will be a hybrid meeting, so we'll be live streaming it as well. It will be recorded, and people will be able to access it later. And people can register. They can go right to our website. There's a link there. Stuart, I'll send you the link. The clickable poster for it as well. But it is free, and you can sign up at any time. Again, you can go to mscare.org, and you can find the annual meeting there, and there's the section for the patient program.
Okay, thank you for that. And let's see, can you tell us again about the research that you guys are involved with? What's the latest of what you have? Tell me about the latest research that you're doing.
Well, NARCOMS is number one because it's been the first and it's the most beloved in my mind. NARCRIMS has been generating a lot of research about healthcare outcome economics, and we've had posters and platforms at a number of national and international meetings, of course most of them virtual this past year. We're learning, for an example, we have over 855 patients in NARCRIMS. We're learning that people with MS are, in general, in this registry, are not living where they were born. They're a very mobile society, believe it or not. I was amazed. We're learning a little bit about the drugs that they're taking. We're, of course, going to learn a lot. We've added a question about COVID now, and we're going to learn how many people within the registry have experienced COVID and what the quote-unquote long-haul implications are. And we're going to be looking at the outcomes of certain drugs when a person does develop COVID to see if there's any implications. It's all underway. NARCOMS, on the other hand, has generated a huge amount of research. And every day I keep getting, today I just got an email from a young member of the Cmsc. We get requests all the time for our members who want to do research to learn more about MS. And that brings us to the Mentorship Forum, which Nancy's in charge of through our foundation. And you want to tell them about the medical students?
Sure. So we have there's the medical student research program, which is really exciting. I'm learning more about it as I'm getting involved with it. They will present their research next year at the 2022 program, the ones who were chosen this year. So they're going to work on their research project all year long with their mentor, and then they present it the following year. This year we have our mentorship forum. The people who were supposed to come last year will come this year because, again, everything got switched up last year. So it's really exciting. They're going to catch up. They're going to meet up with their mentors, and they'll learn from each other. So it's very exciting.
What about a changing face of MS?
Oh, yeah, the ever-changing face of MS. Neurology Live is working with us, and it's basically a mentorship series. Once a month, they pair a more experienced clinician with a newcomer, and they have a conversation over an hour. And the second one is coming up next week. I think it's the 19th. So that's a very exciting initiative because, again, it's all about mentorship.
And Nancy, maybe you could forward that to Stuart. He could share that. Because anybody can log on. It's for young people training in MS.
Right.
Nancy, you got
I'll
the
send you
information yet? If you could send it to him.
I will send it to him.
So I was going to ask that as well. How can people get more involved with CMSC from the professional standpoint, or even learning what you have for any patients that are out there?
Well, for direct patient services, we really are quite limited. We have brochures called an empowerment series that Dottie Fole helped us put together. We have something called the MS Perspectives, but we feel we're doing our services for the patient, as Nancy said earlier to me, that we're training the professionals to take care of them. We've trained thousands of doctors and nurses and rehab specialists and mental health professionals and a number of advocates. And we have the exam, and by certifying them, we validated their experience to give patients a good comfort level that they're dealing with people with expertise. So indirectly, we help that way, but we're not, as you do, we don't provide the services that you and the other members of the coalition provide, because our target audience, quote unquote, are the professionals.
Right. Well, I'm going to ask you both, what would you like the community that's watching this program tonight to know more about? Principal things. Is there anything in general that you guys want them to know about?
Don't smoke.
Well, I'd love to see them all register for the patient program coming up. I mean, because it is patient focused, and they could learn a little more then. Okay. June, what else for the patients?
Nancy, do you have a website for that?
I know you're going to be doing yoga and Tai Chi, well, not Tai Chi, but yoga and Pilates. I think that wellness activities are very important. Watching your weight, keeping active, no smoking. Take your medication as prescribed. Don't fool around and don't adjust dosages. And go see your clinician. Don't just take the medicine and go off, get your blood work, follow up with your MRIs, because we need expert patients. And I think organizations like yours, Stuart, create expert patients. And that's what we really need, because we can't go home with you. We can't go home and make sure you take your drugs or watch your health or eat properly. And don't go off on crazy diets, and don't start taking over-the-counter stuff that people tout to say is a cure for MS. When I first started in MS, we had snake venom and we had hyperbaric oxygen. And today we have legitimate, and bee stings. Today we have legitimate drugs that cost a lot of money, but they're worth every nickel. Because when I go to an event with patients, and I don't know how you've seen it, and I know Nancy and I have talked about this, you see many fewer wheelchairs.
That's right.
Right?
That's
I think the drugs are making a difference, but you got to take them. You got to take them, and you got to do all the wellness things that my friend Megan Weigel talks about.
That's right. So for people to know, I mean, most people that are on here have seen our programs that Megan has spoken at also. She's a phenomenal speaker. But let me go back to the patient program again that you're going to be doing at CMSC this year. Who are the speakers, and what are the topics that they will be discussing?
Nancy, just the paper. Come back, Nancy.
You disappeared,
okay,
Nancy.
So I'm sorry. Okay, so our chair is Dr. Randall Shapiro, and he's going to be talking about through the history of MS and what does it mean for us today. We've got Gary Birnbaum talking about journeying forward in MS, the research implications. We have Peter Wade about his journey as a neurologist living with MS. And then finally, we're going to wrap it up with a rehabilitation journey with Patty Bobrick.
Gotcha. So can you tell everybody right now how they sign up for this?
Sure. Again, go to www.mscare.org, go to the annual meetings, patient program, and just click. It's free.
More about MS, Nancy, right?
What's that?
More about MS.
Oh, it's called More About MS, right?
Right.
Right. All right, great. All right. So what else do you want them to know about that program? Anything?
We want them to come and enjoy the exhibit hall. Certainly, there are a lot more goodies given away in the patient exhibit hall than in ours, because they have these pharma guidelines that preclude any kind of. We used to get all kinds of goodies like pens. They're not allowed to give them out now, but for patients, it should be a lot of fun.
Well,
Oh,
if they
and
come to if they come to the MS Views a new booth, they could get all that.
That's right, exactly.
Right.
And they'll
Right,
get
next.
lunch served at the MS program.
That's right. That's right. All right. Well, I have no other questions for you this evening. And so again, I'm going to ask if you want to just freestyle and tell us what you want to tell us, then I'm ready to hear that. I'm sure others are too. Otherwise, I think we covered everything that we wanted to discuss.
I think so. Thank you very much for this opportunity. Just know that you are a very valuable resource for the MS community, Stuart, and we applaud you. And we thank you for your help ahead of time for our meeting coming down to Orlando. And it's wonderful that we have our team and you are part of the team. And I thank you
very much. Thank you very much. And yes, we will be promoting that event. And I've already seen the location of it. Beautiful, beautiful property. I mean,
yes.
even if you don't go to CMSC, you got to go to the hotel. All right.
Yes.
It is gorgeous. And the golf course,
by the way,
the golf course looks great too. What's that?
There is a Mr. Rosen, by the way.
There is a Mr. Rosen?
Yeah, when our group went down to do a site visit, he came to say hello.
Yeah, he's all over this area. They've got a whole bunch of hotels around there.
Yeah.
So there's Rosen Creek, there's Rosen this, Rosen that. Yeah, they're all over the place there.
That's right.
Right.
Well, thank you again for the opportunity. Nancy, it's wonderful working with you.
Thank you very much.
Thank you very much. Right there.
Hey, everybody have a great night. I want to thank you both for coming online tonight. I want to thank our audience for being here. And just remember that the MS Views and News, we have programs coming up next week. We have our physical therapy coming up again on Monday night. And then towards the end of the week, we have our race, culture, and community event. And then the following week, we have our Compass to Care program again. So just go to the MS Views and News website, see what we have remaining for this month. And remember, next month, 11 virtual programs, all right? 11. Yes, we got it all going for you. Ladies, again, thank you again for being here and for doing everything that you are doing in research and otherwise for the MS community. Have a great night, everybody.